Hi, Eileen Bayer, the fam here. Welcome to the final installment on Parkinson's disease in our mini mental health series. And in this one, we are going to be covering the diagnosis, treatment, and care of Parkinson's. But before we begin, let me remind you to listen for the three key words in this. And at the end of the comments, put in the three key words along with your comment to be eligible for a free merch giveaway when I reach 2,000 subscribers. So let's get started. Since there is no specific test to diagnose Parkinson's disease, the doctor trained in nervous system conditions, keyword, neurologist, will diagnose Parkinson's disease based on your medical history. A review of your signs and symptoms and a neurological and physical examination. Your doctor may suggest a specific single photon emission computerized tomography, better known as a SPECT scan, called a dopamine transporter or a DAT scan. Although this can help support the suspicion that you have Parkinson's, it's your symptoms and neurological examination that ultimately determines the correct diagnosis. Most people do not require a DAT scan though. Your doctor may order lab tests such as blood tests to rule out any other conditions that may be causing your symptoms. Imaging tests such as MRI, CT, ultrasound of the brain, and PET scans may also be used to help rule out other disorders. Imaging tests, though, aren't particularly helpful for diagnosing Parkinson's disease. In addition to your examination, your doctor may give you carbidopa, levodopa, which is Rytary, cinnamon, and others, which is a Parkinson's disease medication. You must be given a significant dose to show the benefit, as low doses for a day or two are not reliable. Significant improvement with this medication will often confirm your diagnosis of Parkinson's disease. Sometimes it takes time to diagnose Parkinson's disease. Doctors may recommend regular follow-up appointments with neurologists trained in movement disorders to evaluate your condition and symptoms over time and diagnose Parkinson's disease. For the treatment, Parkinson's disease can't be cured. There is no cure for Parkinson's, but medications can help control your symptoms, often dramatically. In some later cases, surgery may be advised. Your doctor may also recommend lifestyle changes, especially ongoing aerobic exercises. In some cases, physical therapy that focuses on balance and stretching is also important. A speech-language pathologist may help improve your speech problems. For the medications dealing with Parkinson's, some medications may help you manage problems with walking, movement, and tremors. These medications increase or substitute for dopamine. People with Parkinson's disease have low dopamine concentrations. However, dopamine can't be given directly, as it can't enter your brain. You may have significant improvement of your symptoms after beginning Parkinson's disease treatment. Over time, however, the benefits of drugs frequently diminish or become less consistent. You can usually still control your symptoms fairly well. Some of the medications your doctor may prescribe include levodopa, keyword. Again, levodopa is the key word. The most effective Parkinson's disease medication is a natural chemical that passes into your brain and is converted to dopamine. Levodopa is combined with lidocaine, which protects levodopa from early conversion to dopamine outside your brain. This prevents or lessens side effects such as nausea. Side effects may include nausea or lightheadedness. After years, as your disease progresses, the benefit from levodopa may become less stable, with the tendency to wax and wane, otherwise known as wearing off. Also, you may experience involuntary movements after taking high doses of levodopa. Your doctor may lessen your dose or adjust the times of your dose to control these effects. Levodopa infusion. Dopa is a brand name medication made up of carbidopa and levodopa. However, it's administered through feeding tube that delivers the medication in a gel from directly to small intestine. Dupa is for patients with more advanced Parkinson's who still respond to carbidopa, levodopa, but who have a lot of fluctuations in their responses. Because Dupa is continuously infused, blood vessels of the two drugs remain constant. Placement of the tube requires a small surgical procedure. Risks associated with having the tube include the tube falling out or infections at the infusion site. Another thing is the dopamine agonist. Unlike levodopa, dopamine agonists don't change into dopamine. Instead, they mimic dopamine effects in your brain. They aren't as effective as the levodopa in treating your symptoms. However, they last longer and may be used with levodopa to smooth the sometimes often on effect of levodopa. Dopamine agonists include Paramexio or Mirapax, Rope and Roll, and Rogatine, which is given as a patch. Epomorphine which is a short-acting injectable dopamine used for quick relief. Some of the side effects of dopamine agonists are similar to the side effects of carbidopa, levodopa, but they can also include hallucinations, sleepiness, and convulsive behaviors such as hypersexual activity, gambling, and eating. If you're taking these medications and you believe you behave in a way that's out of character for you, please talk to your doctor. MOI inhibitors, these medications include, they're different ones, but they help prevent the breakdown of brain dopamine by inhibiting the brain enzyme. And the enzyme metabolizes brain dopamine. Side effects may include nausea or insomnia. When added to, though, the carbidopa, levodopa, these medications increase the risk of hallucinations. These medications are not often used in combination with most antidepressants or certain narcotics due to potentially serious but rare reactions. Check with your doctor before taking any additional medications with an MAOB inhibitor. They also have COMT inhibitors, which is a primary medication from this class. The medication mildly prolongs the effect of the dopa therapy by blocking an enzyme that breaks down the dopamine. The side effects of the COMT inhibitors is increased risk of involuntary movement, where was I? Excuse me. Okay, mainly result from an enhanced lidophobia effect. Other side effects include diarrhea or enhanced lidophobia side effects. Another COMT inhibitor, which is Tasma, is rarely prescribed due to the risk of serious liver damage and liver failure. And they also use anticholinergics. These medications were used for many years to help control the tremor associated with Parkinson's. Several anticholinergic medications are available, including benztropine and triamcinolone. However, their modest benefits are often offset by side effects such as impaired memory, confusion, hallucinations, constipation, dry mouth, and impaired urination. There are some surgical procedures, which is deep brain stimulation, where surgeons will implant electrodes into a specific part of the brain to help with it. And there's some alternative medications that we're not going to go into. I'm just going to name a few. Massage therapy, Tai Chi, yoga, pet therapy, and of course exercise. And that's the basic things that they do to help Parkinson's, but it's horrible because it does have such a debilitating effect, and where there's no cure, the only thing they can do is try to control the symptoms of it. That's it. Please watch out on my Twitter and on my community tab for the poll that's going to be coming up on what you want covered next. Until I see you again, remember, see with your heart and not your eyes, because what the eyes see is not important. What truly matters is invisible to the eye, and only the heart can see. So until I see you again, I love you. Bye.